Good afternoon and welcome to Maximizing Your Impact, Integrating Communications and Government Affairs for Successful Advocacy. My name is Casey Dillon and I'm a Managing Supervisor here at Cura Strategies, the organization sponsoring this webinar. We're an award-winning integrated communications and public affairs agency focused on one thing, transforming healthcare. Today, we're going to show you how you can break through the noise and achieve your organization's policy goals. You'll learn our framework for planning winning advocacy campaigns, how integrating communications and government relations can build brand loyalty while advancing your policy goals, and which advocacy tools you can leverage, all highlighted by real-world examples of successful campaign efforts. A few logistics before we get started. This webinar is being recorded and will be made available on curastrategies.com. Please use the Q&A box to share questions throughout the presentation. We'll address questions later on in the session. Without further ado, I'm pleased to introduce today's speakers, Ann Woodbury and Scott Leeser. Named one of PR News's 2020 Top Women in PR, Ann Woodbury is a sought-after strategic counselor who applies her unique background in government, communications, and public affairs to develop breakthrough campaigns, coalitions, and organizations that drive improvements in healthcare. Her creation and leadership of advocates for opioid recovery helped earn Cura the Provoke New Agency of the Year Award in 2018 and nominations for 2020 Boutique Agency and Healthcare Agency of the Year. Ann co-founded Cura Strategies after spending over a decade at Omnicom and spent the first 12 years of her career working with former Speaker Newt Gingrich, with whom she co-authored Saving Lives and Saving Money, Transforming Health and Healthcare. Scott Leeser, Cura's Vice President of Government Affairs, is a seasoned strategic public affairs expert with over a decade of bipartisan government relations consulting experience. Scott's expertise in public policy and political landscapes helps him to develop and implement strategic policy agendas that meet his clients' goals and objectives through relationships with key stakeholders. Previously, Scott served as Director of Government Affairs at the Federal Group and was a former health aide to Senator Dick Durbin. Well-connected, passionate, and highly motivated, Scott's commitment, specifically in the areas of heart disease and veterans' health, earned him PR Week's 2019 Most Purposeful Agency Professional. Ann, over to you. I think you're still on mute. Classic Zoom.
Thank you. It's classic. We had to go. Thanks, Casey, and welcome everybody to our first webinar in our new series, The Art of Advocacy. Scott, do you want to go to the next slide? So we thought what we do here is level set on what exactly we mean by advocacy. So it's always good to go back to Webster, the act or process of supporting a cause or proposal. But in healthcare, there's a lot of different ways that people talk about advocacy. Patient advocacy, for example, that it can be talked about as being a good self-advocate, being a caregiver, being somebody who's looking out for the patient. There's an entire industry that has sprouted up over the last decade that can help you navigate the system and work with the insurance company, for example. There's also, and particularly in pharma and in device companies, for example, you might have a patient advocate staff person, and that is in their title, but they may have nothing to do with policy, for example. It's really about the full spectrum of how a company interacts with the nonprofits and the patient communities. It could be hosting community groups or a chat or an event that allows the patients to come together. It may have nothing to do with policy, but what we're going to be talking about and focused on in this webinar and in this webinar series is issue advocacy, the systemic-based, issue-oriented, policy-oriented advocacy that can really change behavior on either the public side or the private side. So for example, on the public side, we know about statutes and laws and regulations, but on the private side, we're actually seeing something right now with Facebook, for example, where we're having a huge advocacy campaign around to boycott Facebook advertising in July because of their policing practices and people wanting to change some of their policies. That's a good example of some private advocacy. Let's go to the next slide. So how do we do it? A lot of times when people think about policy advocacy, they think about the main tool being government relations, and it certainly is an important tool. But even how people think about government relations, and I go on vacation, I talk to my family, and people think about government relations as lobbying, as the dark rooms, smoky rooms, rubbing elbows, the shoe leather, lobbying, the connections. And certainly, you know, there's a part of this that is definitely about the direct interaction with lawmakers. And I don't know that it ever really was that typical that stereotype, but right now, advocacy, particularly with the advent of the internet, is so much more than government relations. It certainly plays a key part, the direct communications, but we have an entire toolbox filled with other tools to get your message out and to advocate your issues. So on the next slide, we'll see that there is a little bit more in the advocacy toolbox than just GR, government relations. You know, specifically stakeholder engagement, having other people join you and validating your issue and sharing your point of view. That's very important. Events, they certainly look differently in this post-COVID world where we have more webinars and we have more online events, but they're critical still to getting a group of people together to show the validation, to educate people in a very concise time period about a particular issue. So events are still very relevant. Research, you know, if you don't have the research to validate your point of view, then it's about funding the research to make sure that you have the data you need to support your cause. Grassroots, you know, with the internet, it's so much easier now to find those niche populations, the niche groups out there that want to support your cause, but you just have to give them a platform to do that and to help them activate and make it super easy. That's the key here, is to making it super easy for them to engage. And we're going to share with you some examples of how we've been able to do that in some different communities. And lastly, for the communications folks that are on the phone, you know, we're familiar with this PESO model, right? The paid media, the earned media, the shared media, and the owned media. And these are all critical elements to create that surround sound, the overarching umbrella sound for advocacy. And we're going to go into that a little bit more detail later. But the key part of the advocacy toolbox here, and this is the big idea and why we were so passionate about doing this webinar, is that their advocacy and issue advocacy can be a bridge and support both your corporate communications goals and can be critical to shaping your market. And that has really been, in my experience with my background, having worked in 12 years in a non-traditional, you know, we're doing public relations, but not even really knowing I was doing PR until I got to an agency, and you know, they use different lingo, but the goals were the same. In many cases, you know, there is an opportunity to build your brand and build your reputation, build your relationship with stakeholders by being a strong advocate, of being a strong community advocate. And one particular policy change could have a dramatic effect on your marketing, not only on your marketing strategy, but actually on the market size. And I think that is what I noticed that the communications community maybe misses about government. And frankly, I think what government relations people miss, that there are all these other tools in their toolbox that have benefits if we could just communicate with each other. And that's really what Cura is passionately about. The more we do this, the better we can make that connection, the more we can transform healthcare, which is what our passion and our vision is. That's why we created this webinar, The Art of Advocacy. Let me show you a little bit more about what we mean by the way that issue advocacy can help shape a market. And I'm not going to go through all of this. It's a little bit wonky, but I just want to give you a flavor. So for example, you know, government payer coverage for Medicare and Medicaid. I mean, when you take the VA and the Indian Health Service, you're talking about almost 50% of the healthcare dollars are related to government payment. We have done work, for example, through Advocates for Opioid Recovery, with Medicare OTPs, that's opioid treatment programs. They were not covered by Medicare. We're going to get into this a little bit later, but they weren't covered by Medicare. But that was a huge opportunity. It was a missed opportunity for patients to access the opioid treatment programs. But additionally, you know, it was a great opportunity for the people who made the supplies, the medication-assisted treatment that OTPs were using. Additionally, alternative payment models. I mean, again, you know, this is a Medicare thing where they're doing alternative ways, value-based purchasing, you know, the different ways that are out there. That's very important to the payer community, the purchaser community, for example, and those types of authorizations can really change the marketplace. A timely congressional inquiry, as an example. You know, one of our clients is a prostate cancer biomarker test, and they were trying to, or had been targeting the Veterans Health Administration, because unfortunately veterans, you know, prostate cancer is the #1 cancer that they die from. And so the VHA was a natural market for them and an important market. And this is the standard of care right now. Well, very little uptake was happening. And so, you know, they certainly worked directly with the VA, but it was also important to share with oversight committees, the Veterans Affairs committees, and for them to kind of send a letter and say, hey, you know, what is the status of this? What's going on here with the prostate cancer biomarkers, to help elevate it in the central office. Regulatory guidance, approval, interpretation. I mean, some of my friends on the phone, I saw some folks from the ADA on the phone. I mean, we remember, you know, trying to get that National Diabetes Education Program, the providers, getting them a Medicare provider status so that they could, there was a lot of regulation and a lot of rulemaking that went into that. Right now, who's eligible for those provider relief funds, the billions of dollars that are out there? You know, we work a lot in mental health and provider communities, OTPs again, and other behavioral health were largely left out of the first round. And so it took advocacy, and that was critical to the provider community. Direct appropriations, you know, these are things that can definitely shape your market. In the case of, for example, the cardiomyopathy line item in the DoD peer-reviewed medical research program, it's a mouthful, but we got a specific line item in there for the Children's Cardiomyopathy Foundation that was so important to that community, but it was also important to the drug companies out there that are in that space, and it helped them. I mean, they were partly supporting our work on that, and so, you know, it helps them, but it also really helps the community, and it was a great way for them to partner. There's other examples here, but I think you kind of get the picture that there's huge opportunity here to really change the market through successful policy advocacy. But that's not the only opportunity. Go to the next slide. A few other things in the process when you use those tools in your toolbox. There are additional benefits. For example, you're demonstrating your thought leadership, or what we like to call thought partnership. You're validating that you're more than just your words, that you're putting, you know, your money where your mouth is, you're active in the community. You're further advancing awareness and champions for your issue and your point of view, and that expands your market. You're proving your commitment to stakeholders. You're building the community of patients who would, you're proving your commitment to the community of patients that would benefit from this. You're building stronger relationships with stakeholders. You're providing content. I mean, when you're in this world and in this activity, you have an opportunity to create all kinds of good, you know, content that validates what you're doing out there in the community and builds those relationships in your e-newsletters, you know, in your social media, with your supply chain and with your customer communications. And in the case of getting research funding, I mean, that's money you don't have to spend, and it has better credibility than coming from necessarily from industry or a trade group. So again, some benefits and the importance of, you know, coming together and using all those tools in the toolbox. So the question is, where do you start? How do you do it? We promised you we'd give you a framework. This is our framework. It's shaping the market. That's kind of the theme here. So shaping, starting with S, we're going to go through these in each a little bit more detail. First, strategize and plan, you know, finding what your policy and issue priorities are. Second, harmonizing your story, making sure that you and your stakeholders are on the same page about what you're asking for, and that you have your proof points and you have your story straight. Thirdly, allying and aligning and activating both internally and externally is really important. And then the P part of this, which is where most of the activity actually and the expense and resources go to, is progressing the campaign, using all of those tools in our toolbox, but also evaluation and evolving it based on those learnings. Let's take a deeper dive into strategizing and planning. What we're talking about there, and the way that we do it when we facilitate these types of things for our clients, is first we do an external landscape assessment. We look at a lot of different things, but to keep it simple, what is the community that you're involved with, or your customer community, your stakeholder community? What are they already prioritizing? You don't have to make it up. Let's look at what they've got going on and what your key stakeholder groups are on their platform. And then internally, you think to Scott, you're flipping through here. Internally, what public and private pain points will you help relieve, and looking at what assets, what value you can bring to the table, and what, frankly, maybe it's that you need something, and then it's trying to figure out how that could potentially intersect with the external stakeholders. That ends up having a number of issues on your that you could potentially prioritize. Maybe there's 2, maybe there's 4, but how do you decide? We've created what we call the issue rubric, and it has a number of questions, and it's a methodology and a quantitative methodology that helps you prioritize. Some of the examples in the issue rubric, some of the questions, for example, is there evidence to support your point of view? Is there already established momentum or opposition? All of these things can impact, how you basically do this. And so we're going to have another webinar on the issue rubric. Now you can go to the next slide, Scott. I mean, you just want to flip through those, don't you?
Sorry, it's super sensitive. Here we go.
Okay, you're doing great.
Okay.
I mean, I should probably just do it myself, but that's too much for me to handle. So thank you for being the driver. So on the H side, it's harmonizing your story. And, this is a very important step, and it usually takes longer than people think it does, but to build your message and develop those proof points. But actually, it's pretty formulaic. It's very important that when you're communicating with policymakers, that you identify the problem very clearly with supporting points. You identify the solution with supporting points. And then, critically, you have an ask. Don't just stop at the solution and let them figure it out. Do the research, work with the stakeholders, work with policy experts and government relations professionals to identify what specifically are we asking Congress or the administration or the state governments to do. Here in the next slide is an example of, I mentioned before about the opioid treatment programs and how with Advocates for Opioid Recovery, we were advocating in 2018 around the Opioid Support Act for inclusion, among other things. We also did telemedicine and IMD exclusion and other types of things, but this was our #1 priority because it was just so ridiculous that it wasn't covered. So you see here at the very top, boom, 1. What's the problem? American seniors are not accessing opioid treatment programs or don't have access to opioid addiction treatment, all of the options. 2, what's the solution? Well, we need to expand Medicare Part B coverage specifically. Again, we had done our research. We weren't just saying Medicare. We were very specific. And 3, we've got some bills that we would really like you to co-sponsor. Okay, now take a step back. What are OTPs? What is the problem? We stated that very clearly on the first side of the one-pager. On the last side, or the second side, then it's boom, here is our fix. And it wasn't just any fix. Like, we needed Congress, and in order to expand it, we needed it in statute. We needed Congress and the president to act. Here are the bills we want you to co-sponsor. We made sure and humanized it with a patient story about somebody who was threatened to get kicked out of opioid treatment because they couldn't afford it because they were turning 65 and that was going to be their source of insurance. You see there at the bottom, important citations. And then my favorite part is when we were able to go back and dig back into government reports from NIH, CDC, for example, and show that the government's own report said that opioid treatment programs are a vital part of our infrastructure and should be one of the key things that we make sure and access. That was in 2005, before the opioid epidemic, and here we are in 2018. It seemed nonsensical that Medicare wasn't covering them. So again, we were successful. This is an example of how you can clearly share your messages, the problem, solution, and ask. All right, so the next one is around aligning stakeholders. I know I've been talking a lot. Aligning and activating stakeholders. We are also going to have another webinar on this because this is a passion area for us. We love coalition development and stakeholder engagement. I think I just want to say first, though, but it's important to align internal stakeholders as well. As a government relations professional, if you're getting excited about some of these other tools in your toolbox that maybe you haven't used, talk to your communications people. They will be excited to have you come and talk with them about what your priorities are. And the same thing if you're in the comms department or in a marketing department, you know, make friends and talk more with the government relations people, because I think that you can align around that and then go to the executives with a clear plan that gets them bought in as well. And that means you're not out there on a limb doing something that the company doesn't want to do. You also, the GR people example may have an issue they already would love your help on if you're on the comm side. So internal alignment's important. External alignment is also very important. And here, just for simplicity, we're dividing it into 3 tiers. One are your must-haves. You know, I did a lot of work in diabetes with Novo Nordisk for quite a long time, and who had excellent stakeholder engagement. And anytime we talked about something going on in diabetes, it was, you know, of course, it was like, where's the ADA on this? You know, where are the clinical endocrinologists? Where are the diabetes educators? You know, where's JDRF? Those were the people that Congress was going to pick up the phone and call and find out what their point of view was and what their opinion was. So those were, you know, ideally, and depending on the issue, they were must have or nice to have, and they certainly needed to be neutral. If opposition, we were going to have some challenges. So it was important for us to be, working together to find solutions that work for everybody. Sometimes they're just people that are nice to have. You know, it's great. You know, numbers are great to have a lot of people in coalitions, but you know, they may not have necessarily the resources or the clout to bear. But again, you know, important groups to have. And then, as I mentioned, the neutral people, the people you want to kind of keep informed. Maybe your issue doesn't rise on the top 5, but you definitely don't want them out there opposing it. You want them to be looped in. So then it comes the big one, the P, the progressing the campaign. And we talked a lot about, you know, some of these things, but I wanted to focus a little bit more on that peso stuff that I talked about earlier. This is going to be repetitive for some of the comms people on the phone on the webinar here, but on the next slide, it kind of outlines what we mean by each of these things, because with integrated communications, it has changed quite a bit. You know, for example, paid media. People used to think it was, you know, broadcast, TV, radio, bus stops, billboards. Well, that you needed to have like $1 million to break through, right? That is not the case anymore. The budgets, you can be very effective in your geo-targeting and your psychographic targeting with digital ads, with social media ads, through search engine marketing that can help you break through on the paid side. Also, when you see the sponsored content, for example, sponsorships, all of those go into your paid media strategy. It's highly, it's great for awareness building, but of course people know it's pay for play, so the credibility is not as great as it is, for example, as with earned media. Earned media is your traditional media relations, you know, the Washington Post, the regional outlets. But even today, there's so much more with the ability to do bylines, op-eds, podcasts are just exploding, particularly in this, you know, post-COVID world where people are getting their information audibly and through webinars. That's a big part of that, to have that kind of earned media strategy. Also, shared media or social media, Twitter, Facebook, you know, depending on your audience, LinkedIn, Instagram, all the platforms. But there's also specific community platforms that are really important in different types of disease states, for example. Event participation. This is where, you know, it's shared because you're putting something out there. You're able to share your point of view, but you're also welcoming people to react to you. And then on the own side, it's so sensitive. On the own side, this is your website, your marketing collateral, you know, direct mail, emails that you blast out. You totally control the message, and this is important to get your point of view out there and to you know, establish that message arc, establish that story, so that other people can pick it up. So the own media is really critical. So you're progressing it through all of these tactics, and then ultimately it's about how to measure success and evaluating it. This is critical to us at Cura. I'm about to stop talking, by the way, and let Scott take over and give you an example, but don't forget to to start asking some questions in the Q&A as well. But on the evaluation slide, we have got, you know, 3 different kind of levels of evaluation. First, it's about outputs, and these are, you know, this is a numbers game. This is about activity. It's about, you know, more shots on goal, as my husband loves to say. You know, the number of meetings held, the number of website visits, you know, the number of speaking engagements. But it's not really about qualitatively assessing what is happening with that stuff. That comes in outcomes. That's when it's about, you know, what did that earned media article say? Did it share my point of view? The stakeholder level of effort, for example. Are they actually engaging, or are they just putting their logo up there on the website? You know, government, great meeting, but are they actually going to co-sponsor the legislation, as an example? But it's also, although there are these milestones and these lessons that learn help us shape our strategy, it's important to focus on the end goal, which is the policy change, because that's in this process takes a long time. So it's important to have these milestones, but it's important the policy change is the ultimate, you know, evaluation metric. So at this point, we kind of, you know, petered in some of our case studies, but we think that there's one that, you know, we've chosen one, I should say, that we think is really applicable to a lot of things that we're working on right now, and that you guys might be interested in.
Great, thanks so much, Anne. You know, I think, you know, what Anne has walked you through is the SHAPE model, our framework for how we integrate communications and advocacy. And I think one of the best, you know, client spotlights for this is CareDx and Honor the Gift. And so I'm interested today to share with you what we've been working on for about the last 15, 19 months or so that really allow us to kind of put this framework into practice. And so, you know, to give you a sense of where we started. So CareDx is a leading provider of genomics-based information. They make tests that are genomic-based and allow clinicians to have a better understanding of potential acute rejection in kidney transplant patients. But they also do some testing on the matching side and some digital healthcare solutions. And so they really offer a whole wide variety of services and products for transplant patients across the patient journey. And they approached us and they said, you know, that they really wanted to be known as a company that doesn't just sell products and services, that they wanted to show that they have an investment in this community, that they wanted to demonstrate their leadership, and that they wanted to take on an advocacy issue that would make a real change in the patients' lives, that the transplant patient lives that they serve. So one of the issues that kind of rose to the top, so as we look at the strategy and the issue rubric, you know, we had some back and forth. We ran them through the issue rubric on whether or not it made sense to the internal and the external stakeholders and where the community was at. You know, this was an issue that had been around for 20 years, and that posed some positives in terms of the education and awareness and getting people to align around a particular issue wasn't going to be challenging. But had the community moved on, had they saw this as like a battle that had been fought and lost, and that they were ready to tackle new challenges. And overall, we came around to this immunosuppressive coverage issue, which is essentially providing safety net coverage for any patient who had undergone end-stage renal disease, had been covered by Medicare, which Medicare covers regardless of patient disability status or age, but ultimately had this policy, which was that they were dropped from coverage 3 years after their kidney transplant, and, you know, posed a risk at the longevity of the kidney and ultimately the patient's lives. So this was something that saved Medicare money and was good for the patients. And we thought that we could make a difference by coalescing that community and really putting, you know, a tip to the spear, as they say, around this issue by bringing the community together. And the other thing that's important to note in this strategy was that CareDx did not benefit financially from the expanded coverage. So they are a testing company post-transplant, and so there was no direct financial benefit, which we thought really helped show that, you know, by investing the time, energy, and resources that they really could show that they're patient focused and it wasn't about them or the bottom line. And so together, we came up with a branded campaign, the Honor the Gift campaign. Here's our logo here. It's a national patient-centered campaign sponsored by CareDx, but promoted by a coalition of kidney and transplant organizations. So going back to the slides that Anne presented earlier, what are those extra benefits to government relations that are kind of being missed? You know, being able to strengthen those stakeholder relationships, show that you care about the community in which you serve. Those are all things that we saw were important to the success of the Honor the Gift campaign. Then again, we were singularly focused on this issue of extending a Medicare coverage for immunosuppressive drugs for the kidney transplant patient population beyond its current 3-year cap. And so because we were singularly focused on that and we didn't have 4 or 5 different policy issues, we're able to really drill in and really focus all of our time, energy, and attention on moving the needle on this particular policy and seeing it impacted. We started with having, you know, introductory and eventually recruiting conversations with coalitions, and over time we really have grown our coalition to over 31 members. Here's kind of a look of who are our top, you know, or some of our organizations here, the top 15 or 14 that I pulled out just to kind of show you an example of who is joining this coalition. You know, we have patient advocacy organizations like the National Kidney Foundation, Alport Syndrome, PKD. We have providers like the American Society of Pediatric Nephrology, or NATCO, the National Alliance of Transplant Professionals. We have some what's called OPOs, organ procurement organizations like Washington Transplant Community and Life Gift in Texas. We have, you know, transplant organizations like Donor to Donor and Transplant Life Foundation and Transplant and TRIO, which is the Transplant Recipient International Organization. So we really span the gamut here in our coalition efforts, from the transplant side to the recipient to the kidney side. All of those folks and patients and providers coming together, really singularly focused on the immunosuppressive coverage issue. We also know that we wanted to make this a patient-focused campaign rather than getting, we support our arguments with the available research and some of the reports and studies that have been done, and those are important to making the case in Congress. But it's also important to show the human aspect. And so with the help of CareDx, we're able to identify and recruit patients to really be the spokespeople for our campaign and put together their stories and share it through our social and other communications channels to really drive home the point of the humanizing aspect. And here is one of our patients, Monica Fox. She's a great advocate in this, and we were able to put together a video of her story telling the impact of the Medicare policy. So I'm going to share it here now.
My name is Monica Fox, and I live with a kidney transplant. I was diagnosed with end-stage renal disease. Went into the emergency room and basically woke up 4 days later, having had my first dialysis treatment. I actually waited 3 years and then received a kidney transplant through a deceased donor, a gift of a second chance at life. And you're doing your best to live healthy with it. You must take these medications for the rest of your life, and then all of a sudden, the rug is pulled out from under you, and the security of your insurance coverage is gone. This disease has had a huge impact on my family, my parents, my sister, my daughter. But tomorrow, it could be you or someone you love. So it's important for all of us to speak up and make sure that this important issue gets some attention and gets the right answer. Congress, please honor the gift. My name is
I will
Monica
not make you
Fox,
watch it
and
again. So, you know, being able to tell that human story was important. We've been able to share this through our social media channels, in our some of our meetings that we have with stakeholders, to really show what this campaign is all about. And it's about the patients and the journey that they have, and making this journey easier, less stressful, less worrisome, by providing a safety net coverage for their immunosuppressive drugs. One of the other things we started with was a digital hub, a website, an advocacy place where we could send people, we walk through what the campaign is about, who our coalition partners are, the policy at hand and why it needs to be changed, the supporting arguments. It allows us to provide news and information to our community. And also importantly, it allows us to have a place where we can send folks to take action, to sign our petitions, to sign our pledges, to activate around specific actions, to communicate with their members of Congress. We have a tool built into the website. You type in your name, email address, and zip code, and it connects you with your Senate and representative offices to allow you to send messages on a particular issue using template letters that we've drafted. Since the start of this campaign, 30,000 unique visitors have joined, have come and checked us out on honorthegift.org. We've had over 5,300 letters sent to Congress. And it's interesting to see where they come from. So looking again at the PESO model, that shared component, the social media component, 50% of our followers have come from social media. This is through social media toolkits that we push out to our partners, or our own social media channels that we own and manage, or through shared content. So we post it, it gets shared, and folks find us that way. Additionally, we also look at, we were able to drive some, particularly around when we launched, some initial traffic around some ads. So 25% of our overall traffic came through ads. When we launched with paid advertising, because I think, it's important to get your name out there. And we had some great first party data that allowed us to target those individuals who we thought would be prime for our messaging. And then 20% comes through a direct link. So this is clicking on an email or such that gets you right to the honorthegift.org website. And then on the earn side, we wanted to validate our messaging by having it not just come from us, but also come from the traditional media sources. So one of the biggest focuses of our earned media strategy was on landing a Kaiser Health News feature. And we had identified a reporter. We helped place this article. We helped find the patient. We helped give the information in the background that helped her lay out the article. This no-brainer calls grow for Medicare coverage for anti-rejection drug article appeared last summer. This patient, Alexis, is from Chicago, part of our patient network that we had built up. And it really provided us an opportunity to highlight that this is an issue that's gaining national attention by helping to place this article. Additionally, it can become an additional touch point in your government relations action. The morning that this article ran, I pinged all of our congressional champions with this article, and Senator Durbin retweeted it. And that really helped in kind of, again, validating this issue, that it's gaining prominence and national attention. We also helped write and draft a op-ed for placement in Stat News by Dr. Matt Cooper from Georgetown University. And this appeared on the morning of his testimony before the Energy and Commerce Health Subcommittee. So again, reiterating our point, showing the prominence of this issue, being able to tie it to what's happening in Congress. And sometimes, what you do, for Kaiser Health News, it got reposted in NPR. So just naturally it ran in other places. Kaiser Health News is a wire service, so there was a strategic component to having it run there. But then also, you can have this wide audience, but maybe isn't totally, aren't totally your target. It reaches a wide audience, but isn't just hitting the transplant community. The Gifted Life podcast is the opposite. It's targeted to the transplant community. It's run out of Louisiana. we featured a doctor and a patient telling their story on the Gifted Life podcast, which really we saw a huge uptick in the number of site visits and activations after this podcast ran. And then, we've talked a lot about the communication strategy, but just equally, it's about building the legislative champions, the Senate and the House champions, working with these offices, digging into the legislative language, going through rounds of technical assistance with the agencies. To date, we've got over 60 co-sponsors in the House, and I think our last number is about 9 in the Senate, including Cassidy and Durbin, really championing this bill, trying to build co-sponsors. We've outreached over 400 congressional offices, which have helped us reach these numbers. And again, using our messaging of harmonizing our story through our Honor the Gift campaign. It also hasn't hurt that we've had the strong support from HHS and the administration supporting relief for this time limit. This is Secretary Azar addressing an audience back of last July at the announcement of the Advancing Kidney Health Initiative, and we have his support. It appeared in the president's budget. They've released reports that show significant cost savings. All in all, this kind of echo chamber, administrative and legislative congressional alignment has really helped kind of spur this momentum as well. And so here's some inflection points that we've seen in the campaign. In March of 2019, we launched the campaign. Within a couple of weeks, we had some early results. Secretary Azar expressed his public support for expanding coverage at an appropriations hearing. In May, we met with the White House staff as a coalition, and later that month, HHS released its analysis showing significant savings to Medicare. The administration has looked at overhauling how they're doing kidney health as a whole. We were able to participate in their Advancing Kidney Health announcement. There was a question in the audience that prompted a response from Azar to further reiterate his support. We saw the House introduce its Immunibill in December, followed up quickly with an Energy and Commerce Health Subcommittee, which we were able to help write the testimony and provide some of the insights for the doctor's testimony. The Senate introduced a month later, Health, Energy, and Commerce marked up in March. And then just in the last few weeks, CBO has projected a $70 million savings by you provide the lifetime coverage for immunosuppressive drugs, the safety net coverage, and prevent people from rejecting their kidneys and ending up back on dialysis where Medicare covers again. You can save $70 million through lower cost coverage. So you can see some momentum building over the years. And the last part of the SHAPE framework is the KPI dashboard. It is evaluating your metrics. So every week we provide this to our client team. They can see whether or not we're moving the numbers, how our numbers are, where the sources of our conversions and our traffic is coming from, how long people are sticking around. So again, it's about finding those KPIs, finding those metrics, and really being able to hone in and evaluate and adjust if need be. And so this is just an example of a dashboard we send every single week to our client team of the Honor the Gift. But again, those are the hard numbers, but it's also about demonstrating leadership to the transplant community. And we receive emails, over the course of the 15 months since we've launched the campaign that really speak to that what we're doing is really making a difference in the transplant community, that CareDx is really being recognized for the investment that it's made. And so here's some patients and surgeons who've emailed us, thank you for the help that you're doing for the transplant community and allowing me to use my passion to help. Speaking for many in transplant, I appreciate the investment of time, personnel, and resources CareDx has brought to this effort. It certainly does not go unnoticed. And I'm so thankful for this campaign. It is personal for me, and I'm willing to do whatever I can. Thank you for the awesome platform to work with. This is another key component, is about making it easy for patients and providers to get involved with advocacy. And thanks for the update. No one has worked harder on this than CareDx. I'm confident that we will have it passed later this year. So these are our validation proof points that the leadership, demonstrated leadership through this advocacy effort is working on behalf of CareDx. And with that, that rounds out the CareDx component and the client spotlight of this webinar. And excited to take questions. Casey?
Yeah, awesome. Thanks, Scott. And thank you, Anne. I really appreciate the presentation, and I work with you guys every day. So thank you. We've got some time for questions, as Scott said. If you'd like to submit a question, you can put it in the chat box or in the Q&A box, and we'll read those off. And just a reminder that the slides and recording will be available on our website, and we'll send around an email to all attendees. But first, I mean, elephant in the room, right? COVID-19. How has that changed advocacy work, and how do we break through with everything else going on right now?
Sure, Casey. I think the first and foremost, going back to CareDx, we have been doing congressional Hill meetings now for over a year. Typically, these Hill meetings take place in person on the Hill with legislative staff. And with COVID and the kind of the emergence of now conference calls with legislative staff, we're able to incorporate more folks into that. They don't have to be in Washington. We can incorporate it into their schedule and clinic or in their patient lives. And so we've been able to incorporate patient and provider voices. And it's a little bit of a double-edged sword. I'm really thankful to have them. I think you miss a little bit of that human element and the human touch, but so does everybody in this time. And but it is really, really great. And I think very impactful to have patients and providers be able to share their perspective on these calls with congressional staff to really show, again, that human aspect to this policy.
I would just probably add, it's a great example, and a few of our clients have also, the Provider Relief Fund, for example, there was the way that it was written really left out quite a bit of the behavioral health community and the addiction community. And so it was important to quickly respond because this is happening unusually fast in Congress, although things have slowed down a little bit with the spending. And so, that's where having had the relationships and having spent and invested in those relationships through working together, you're able to activate quickly. I mean, it can't be that time when you start making the phone calls to potential stakeholders to collaborate. So I think, that's just, one example. And I also think the policy landscape and just the reality changed so much with priorities that, it's important to reassess what your policy agenda is, and chances are some things are coming off or moving up or down, and some other things are getting added because of that.
Great, thank you. And this can be a question for both of you, I think. What do you think will be the biggest health issues for Congress over the next year or so?
So, it's such an evolving thing. We already talked about COVID, but the whole idea of infection prevention and we're going to be talking a lot about how the treatment for COVID is being covered, about the vaccine, God willing, when it comes, how it's going to be distributed and paid for example. Those will be key questions, but there will continue to be a lot of questions. I think the implications of how this has changed medical practice through, for example, telehealth and some of the quick coverage decisions that need to be done. I mean, that was one of the reasons why, people weren't adopting, or providers weren't adopting telehealth as much as, the reimbursement wasn't equitable. And I think that is something that's totally going to be reassessed, both in the private pay and public pay. So there's a big opportunity there, which will certainly help a lot of different, particularly transportation challenged patients and other folks. You don't have to take off work, for example. The last thing I'll say, and I'm sure there's others, but this one comes to mind as well, is I think that given the quarantine, given the resistance of people going out and really exposing themselves, particularly folks, that have chronic diseases or immunosuppressed, they may be delaying treatment. And so I think, unfortunately, we're going to see a little bit of a couple steps back on some of the great progress that has been made by prevention and chronic disease, related to primary care and getting your checkups and all that type of stuff. We're going to have to double down those efforts. And, because this, unfortunately, I think we're going to be doing this for another year. You can't go a year and a half without getting your pap smear, or if you take the colonoscopy, don't push it off, the diabetes, getting your A1C checked. I mean, these are important things. And I think there's an opportunity to be communicating with the patients that, it's in some of these cases, it really is, it's worth the risk.
Thanks. Scott, any thoughts?
No, I mean, I think that is certainly going to be all those things, I think Anne kind of hit them all. I will say, the cancer screenings, I think, will be a big component. The telemedicine, the way that we're communicating, that we're serving patients, will be very helpful. And then additionally, I just think overall, like the way that Congress is going to be working and what their focus is going to be, on, infection prevention, there may be a case where, we're not going to be, besides staffers, there's not going to be a whole lot of folks that are going to be allowed in these buildings. And so our access to offices are going to be impacted. And so just, staying on top of everything that's going on and adjusting and being flexible and adapting. I mean, I think everybody is, in all of their personal and professional lives, they're having to adapt. And so the same is true with advocacy at this point.
Great, thank you.
I think I'm just going to add one other thing. I mean, the public health infrastructure and the intersection with education, for example, like I'm thinking particularly about young children and some of the disadvantaged population. I know in my community in Fairfax County, the schools are like the lifeblood of the community for kids, both in making sure they get their shots because they have to get that done before they go to school, but also folks that are using it, to get their nutrition, to get their food. These are important infrastructures that will eventually have an impact on health. And I think that even though it's not directly health, and I know we're a healthcare agency, but I think that these, with nutrition in particular, it certainly affects your immune system and affects your growth. There's so many things there. And so I think these are going to be some really key questions as, state, local, and federal level deal with some of these issues.
Yeah, the impact of this are going to be numerous, very numerous.
Yeah.
We have a question from Arlene. Does Cura Strategies assist on a state level? Here in Florida, behavioral health is struggling to get legislative attention for state regulations that will surely lead to the national platform.
We do advocacy at all levels. In terms of supporting the toolbox, for example, we can do all of that at the state level. We would probably work with somebody in the state on that direct government relations because, they have the relationships, are more attuned with the actual people on the ground, but we would work closely with that. And I think, this is where having kind of almost like the general contractor for a campaign, be somebody that understands both the comm side and the GR side is so important that you can bring that all together. But, certainly we would work with the local folks on the GR side to get their input, but absolutely.
Great. One more question. Do you think that virtual events can have the same impact as in-person events? Any tips?
Yes, I do. I mean, I think that's different, right? I mean, I think that in some ways, I think they can be even more impactful because it's easier, for example, to do what we're going to do in a minute, which is do a poll. But it's easier to get feedback, from people more immediately. And, we're exploring right now with a company doing a consensus, they wanted to, get 40 people in a room over a day and have a consensus document, that limits, there's limits to how much you can speak, for example, but I think if we were looking at different technologies like that they use for advisory boards, for example, with virtual working groups, where over a period of time people can go in and share their input and other people can comment on it. I think people are just more they're more these technologies have become more accessible and are easier to use, despite the fact that I continue to, not unmute myself. But they, generally speaking, I think people are more comfortable with that. So the events, they're going to change, but I think that they can be impactful. It also opens, it's a great equalizer again. As long as we have access to the internet, which I know not everybody does, but you can really get your message out. It doesn't require the travel, the expense, the time away. So I think there's actually a lot of good that has come out of it, but I do think, those larger meetings of collaboration, I know people are going to miss that. And, I don't think they're gone for good at all.
Great, thanks. Did you have any thoughts to add to that, Scott? Or?
Yeah, I think we're doing an event next week. Again, it kind of goes to you can be anywhere at any time. Similar to the legislative meetings example I gave earlier, we're able to connect two congressional staff members, a staffer in the secretary's office, CEO of NKF, the CEO of CareDx, an ASN counselor, all together on a webinar next week for Honor the Gift. And I think that they can really be impactful. We're going to have an SMS short code so people can text in advocacy to a certain number and be able to be provided links to our advocacy tools. And so I think there are methods and methodologies that can make this possible. I also think just in this day and age, you throw out a Zoom link and everybody knows what to do. It's become frictionless. And I think it's going to have a long lasting impact even after the economy and the society is open, that I think we've all become accustomed to how to operate and move and maneuver around Zoom and other platforms.
Great. All right, we've got one last question. And if you have any outstanding questions, Ann and Scott's email addresses and phone numbers are on this slide right here. So the last question, for a paid strategy, if resources are limited, where do you think you can have the most impact?
Digital, period. I mean, you need to know what your goals are. Obviously, you need to, we would need to know a lot more about, what the specifics of, to tell you which platform or, whether to do social media or digital display, etc. But I think for bang for your buck, that's the best place to go.
Great. All right. Well, thank you all so much. Just before we lose everybody, as Ann mentioned, we have a poll for you. So I've started that now. If you have a chance, please go ahead and vote in there. Oh, I have to relaunch it. Oops. Like Ann said, for how often we do this, you'd think we would be pros at it by now. And then one last slide, please, Scott, if you could just go to the next one. All right, so over the next few months, we'll be hosting a few more webinars in the Art of Advocacy series. You can see the titles on your screen right now. Stay tuned for details and dates for those. But until then, thank you so much for attending. And from everyone here at CURA, have a safe and happy and healthy 4th of July.
Thanks, everyone.